Hey there, we're back with another module for you as promised. This module will focus on a caregiver's role and what effect this has on a service user's well-being. The module will also cover the occasions where you will interact and work with healthcare professionals from other organisations. Additionally, you will learn the advantages of multidisciplinary work. Oh, and here's a little bonus for you. There's additional material attached to this module. Make sure to check it out for a deeper dive into the topic. Now, what are we waiting for? Let's begin. Before we start, we have a task for you. Imagine you're a carer. What values would you promote as a care worker? We want you to pause and take note of the values. We hope you've finished making notes. Now we'll discuss the values promoted by health and social care workers. Your task is to determine whether it fits the values you've noted. So here we go. The first one is freedom of choice. A service user needs to feel that they're in control. You should give them the information they need to make informed choices. Then there is rights of service users. You have an obligation to uphold service users' rights. You should also keep them informed about their life and its influencing factors. In addition to these two, there are more values that are promoted by health and social care workers. For example, independence, security, dignity, privacy, and respect. More information about these values can be found in the additional material. So did those values we talked about match with what you were thinking? Maybe some did, maybe not all of them, and that's okay. Now let's move on to our next topic. We figured out what values are important for care workers. Now let's talk about what to expect and where to draw the line. It's like setting up some rules and knowing what's okay and what's not. We all have rights and boundaries, and we wish others would respect them. These come with a responsibility to respect the rights and boundaries of others. As a caregiver, you need to put your professional expectations first at work. There are policies, regulations, and codes of practice that you must follow. Professional expectations are based on the code of conduct. Boundaries can vary. Professional boundaries will tell you where to draw the line. You should not develop an overly close relationship with the service user or disrespect them. Now we're going to move on to our next topic, the code of conduct. So what exactly is it? Well, a code of conduct is essentially a set of rules for behaviour. The Department of Health requires all health and social care workers to adhere to its code of conduct. It's also your obligation not to fall below the established conduct standards. Otherwise, the Department of Health can take action against you. We hope we didn't scare you off. No need to stress about slipping below the conduct standard. After all, that's what we are here for. According to the codes of conduct, you need to follow some guidelines strictly. For example, you must be able to answer for all your actions and omissions and give your reasons. You need to maintain the dignity, privacy, health, rights and well-being of service users when carrying out your duties. You should work together with colleagues in the interest of offering quality, compassionate and safe care and support. You must communicate effectively and ensure understanding. You have to keep the confidentiality of the service user's information and records. You should always develop your profession in order to improve the quality of care you can offer. There are expectations and boundaries that you must not violate. You will get a detailed overview of these codes of conduct in the additional material. Your duties don't stop here, and here's a heads up, there'll be times when you're teaming up with healthcare professionals from other organisations, so you should understand their role and why it's important to work collaboratively with them. These relationships are professional and you should maintain your working relationships with these individuals. Moving on, let's see how many distinct areas of health and social care exist. Any guesses on how many different areas there are? Maybe you've got a couple in mind already. Well, let's find out together. There are 4 different areas of health and social care: voluntary health care, statutory health care, informal health care, and private health care. Voluntary healthcare is provided by charity organisations and voluntary institutions. Statutory healthcare is provided for in the statutes and can be primary or secondary healthcare. Informal healthcare is provided informally by family, friends or neighbours. And finally, private healthcare is paid for personally by the service user rather than by government funds. There are several other professionals listed in the additional material, along with a detailed review of each area of health and social care. All right, let's talk about something that often goes hand in hand with health and social care workers, social services. So what's the motive behind these services? Well, social services care for the welfare of society and the population. They're typically managed by local authorities who work collaboratively with the NHS. However, keep in mind that not all local governments can provide every vital service. Therefore, they must work in partnership. As we're talking about partnership, we can't go ahead without discussing it because it's such an important element of health and social care work. Let's explore how healthcare experts can collaborate. As a social care worker, you may need to work with professionals from other sectors and figures from informal sectors. This is called multidisciplinary working. It allows quicker solutions through collaboration, and the service user receives multi-profession attention. So what does a successful partnership require? A successful partnership requires respect. Everyone in the partnership has value, and there should be no disparity due to issues such as some people being paid. A successful partnership also requires honesty, openness, trust, and good communication. Information should be shared in order to reach the best outcome. But why should you work in partnership? Well, there are several advantages to working in a partnership. For example, advantages of working in partnership include: working in a partnership allows coordinated decisions, which reduces mistakes. It also highlights areas where an individual's knowledge is deficient. The service user's care is spread between more figures and professionals. The approach to the service user's needs will be seamless rather than disjointed. The practice also encourages teamwork. And that brings us to the end of this module as well. In this module, we learned mostly about how we should behave. In the following module, we'll discuss how to promote equality, diversity, and rights. So, without further ado, let's get to our next module, and we will see you there.